I'm excited to introduce Dr. Ashwini Ashokkumar, who received her PhD in social psychology from the University of Texas at Austin, and she's currently a postdoctoral fellow in the Polarization and Social Change Lab at Stanford University, where she uses traditional social psych methods along with big data and natural language analysis to study groups, ideology, and identity threat. We're excited to have her with us today to share her work on the psychological unfolding of COVID-19. So take it away.
Thank you so much for that introduction, Andy, and thank you for inviting me. It's such a great pleasure to be here and to share this work with all of you. As you can tell from the title, this is work that was done fairly recently. This is work I did at UT, where I was for my PhD. And the title of the talk should have really been the psychological unfolding of the onset of the COVID pandemic, because the focus is on the first 3 months of the pandemic. And my goal here was to mainly, I also use survey data, but the main goal was to use social media data to track the psychological timeline of the COVID pandemic. And specifically, like I said, focusing on the first 3 months. And the reason I looked at the first 3 months was that it was around the 3-month mark that that George Floyd was killed and the BLM protest started. And because our goal was to track primarily effects of COVID, and because BLM had its own huge psychological impacts of society, we stopped at around the 3-month mark. And the other reason naturally was that we had no idea that it was going to go on for this long. It feels almost comical to now look back and think that our goal was to track the timeline of COVID, but we stopped at the 3-month period. So I'm hoping to expand this to maybe a 2-year timeline, and also hoping that we don't have to expand beyond that. Okay, so let me rewind to March 2020, or even before that, February 2020. At that point, most of us didn't know what was coming. I don't know if some of you may have been at SPSC, which is the big social psych conference that happens every year. And that happened in the last week of February in New Orleans. And it is, I like to think back to that because it makes it so clear. We had no idea what was coming, because this was about 3,000 people in an indoor conference, and we just didn't know. But shortly after that, a couple of weeks after that, a lot of things changed. Their life really changed in a way that hasn't gone back since. But some people were prescient. So this is a memo that the World Health Organization put out on the 18th of March. So still fairly, when at least in the US, the pandemic was fairly new. And we didn't know really what was coming, but we knew that whatever this was, it was bringing mental health impacts with it. Shortly after, the JAMA, the medical magazine, the journal, they published something similar, calling for work on prevention, early intervention. But soon it just became kind of everyday reality. We all knew there was a lot of anxiety. There was anxiety about getting the virus itself, falling sick, about our relatives and family, older relatives specifically, but also more logistical things like grocery shopping, toilet paper, and so on. And soon as this continued and the disruption didn't end, it started feeling like maybe everyone was burnt out and everyone was even depressed. And a lot of people have called this a mental health crisis, a fourth wave of the pandemic, and so on. And when I started this project, this was in March, maybe like the 10th of March, 2020, like everyone else, had no idea what this was going to be. So naturally, I turned to the literature to see, okay, what do we know about epidemics? And the answer, as you might expect, is not a lot, especially pre-COVID. Now, of course, there is thousands and thousands of papers looking at psychological effects of COVID. But at that point, we really didn't know a lot. And naturally, this is because we just haven't, in the last several years, had experienced something like this, at least not to this level in the US or in Western countries where psychology is mostly done. There's some work on Ebola, but it's not comparable. In the US, for instance, the death toll of Ebola was 2 people. And you can tell just from that that COVID has been a whole different animal. But even though psychologists had not studied pre-COVID epidemics, other kinds of social scientists have. This is by a historian, and if you're into this kind of thing, this is a great book and I highly recommend it. And this book is about the 1919-20, what is called the Spanish flu. And it's very interesting because it tracks a lot of, the story they tell about the pandemic, what life was like, how the government responded and so on. There's a lot of similarities with what happened this past year. Even though we don't know a lot from psychology about epidemics prior to COVID, there is a literature we can rely on that is about other kinds of collective upheavals or collective traumatic events like hurricanes and earthquakes and so on. And the general consensus of this literature, the most replicated effects are that these events do produce mental health consequences like an increase in anxiety, depression, and especially among people who particularly suffer greater loss from these events, even PTSD symptoms. And a lot of this work also shows that the best kind of cure to these psychological effects is our social life, is our social relationships coming together, sharing our emotions, and kind of collectively sense making of the event is what helps us. And this work shows that it's the people who have these social ties to rely on, it's those people who recover psychologically from these events the fastest. But epidemics are profoundly different from these other kinds of events. And the biggest difference is that a lot of hurricanes and earthquakes, for instance, are one-time events. They kind of hit society, they play out within a couple of days, and then we are left to deal with the aftermath of them. But with COVID, for instance, it's been almost 2 years and we're still in the middle of it. And it's not clear that we're anywhere close to being in the aftermath of it. So they're prolonged events with a lot of uncertainty, and there are so many sources of uncertainty. One is the virus itself, and we're still learning about the virus, how contagious it is, how severe it is, and so on. So we don't really understand the threat. But it's not just that. There's other kinds of sources of uncertainty too. For instance, with COVID, there's a lot of denialism from the US government, but also in China, the government tried to hide the pandemic initially. And this is not without precedent. For instance, in this book, John Barry talks about how in the 1919-20, the Spanish flu, the US government downplayed the virus then too, because they wanted people to be focused on the World War I and keep their morale high, support the government and the country, and so on. So with all of these various sources of uncertainty and going on for a long time, we'd imagine that the psychological timeline of pandemics or epidemics should be different than these other one-time events. And one thing related to this that I've thought about is that maybe if we have studies on war, which are different in many ways, but also similar in the sense that they're prolonged and you don't always know where the threat is coming from, that might be similar, but we don't have a lot of psychological studies on war either. And another reason why epidemics are different is that the threat level of the virus, it fluctuates. So unlike an earthquake or a hurricane where it hits and then things get better from there, with COVID, for instance, we don't know when a new wave is coming, where it will hit. So over time and space, there's a lot of fluctuation that we might be uncertain about. And finally, something that is very important and unique about epidemics is that we don't get to access other people who are our best source of psychological resilience. We can't come together, can't hug, or any of the things we might usually resort to just because there is the threat of the virus, which then could make it harder for us to recover. So for all of these reasons, I was mainly interested in tracking the timeline of the COVID pandemic to see how various psychological variables change over time, especially around the onset of the pandemic. And one thing I should say here is that at this point, there are a lot of studies on the pandemic. I'm not trying to say that there isn't that work. It's just that when I started working on this project, this was March, April 2020, there wasn't a lot at that point. But even then, there were some early studies that started coming out, but these were naturally cross-sectional because we didn't have baseline data. We didn't know a pandemic was coming. So naturally, that was hard to get. And the other reason was that there were some studies that had these pre-post style longitudinal studies. But as you can imagine, these were typically people who were originally trying to study something else. And then when COVID happened, they kind of adapted their study to study the pandemic, which then means the design is not, it wasn't, the questions they asked in wave one and all of that, it wasn't originally meant to study the pandemic. So they were just not the ideal kind of studies we would want to know really what the timeline of the pandemic is. Okay, so this work I'm presenting today, we had a couple of research questions. The first one, like I just said, was to be able to track the psychological impacts of COVID over time. And here, when I said this on the title slide, our main goal was to, main method here was to use language. And so the variables we looked at, how we selected these were really just what has been studied well in language and what we have a well enough understanding of that we can then make these interpretations from people's language about the impacts of COVID. So we looked at emotions and cognitions of here, how are people thinking over time, how are social ties changing, and so on. And the second question that I was personally very interested in was to see how these psychological effects vary as a function of the spread of the virus itself. So for instance, in the US, the first outbreak was in Washington state around Seattle. So we might expect that the psychological effects do start initially from there, or shortly after things got quite bad in New York. And so we might then expect that the psychological effects peaked there. So it's kind of looking at the temporal and spatial variation of this virus and seeing if the psychological effects follow that, or if it's just this general kind of national a response we're seeing to like a national or like larger, even global upheaval. And finally, this was an exploratory question that was actually suggested by one of the reviewers of our paper. And the graphs are kind of cool, so I thought I'll show that to all of you. So because we use social media data, one of the biggest advantages is that you can go back in time, sometimes several years back in time. So here we thought, what if we could look at the impacts of COVID and compare that with the last several years? The main method we used was using social media data, specifically Reddit. And Reddit is a popular social media website. And for anyone who's not familiar with Reddit, how it works is that Reddit has a lot of communities. It's a bit different from Twitter or Facebook. So it has a lot of these communities, and people typically join and participate in these communities. And the kind of communities we looked at in this project were all city communities. So for instance, there are huge communities corresponding to a lot of the big cities in the US. We looked at 18 such communities, and from this you can see that I wish we had plotted this map at the beginning. You can see we missed a big chunk of the US here, which wasn't intended. If I did this again, we would sample a larger number of cities. And so what happens in these cities is typically I used to live in Austin, for instance. So if I were a Reddit user, I would go on this community, talk about just city life and traffic and weather and what is nice about the city or events. So it's kind of like a city bulletin board or a forum where people are just talking about things relevant to other people in the city. And we were able to extract all the conversations that happened in these communities from January 10th to May 23rd. And these dates are somewhat arbitrary. We wanted baseline estimates that are pre-COVID that were not from the holiday season, because typically there are huge psychological impacts of the holiday season. So we started around January 10th and ended on May 23rd, just because BLM started on the 25th. So we wanted to kind of tightly focus on just COVID effects in that interval. And we got all the conversations that occurred in this context. Our final data set had about 1.8 million posts from 216,000 people across all of these communities. And all of this text was analyzed using Look. This is a popular text analysis program that can be used to analyze text and measure various psychological dimensions from text. So how Look works is Look has a lot of pre-validated dictionaries or word lists that correspond to various themes of interest. So for instance, let's say I wanted to measure positive emotion. The positive emotion dictionary or word list in Luke has words like happy, excited, fun, joy, the kind of common words you might associate with positive emotion. And these were built by a group of researchers through a lot of, and have been validated by a number of papers too. It's not without limitations, but it's still currently one of the most popular methods used to capture the common psychological measures that can be captured from language. So here we used Luke to analyze all of these posts that we collected from Reddit, and then tracked the psychological dimensions from those posts over time in the first 3 months of the pandemic. We also collected some survey data around the same time, started in March 19th, just because that's when we could get the survey out, trying to work really fast that first week. And it was mostly snowball sampling. So we just shared it to a convenience sample, basically shared it with anybody we knew, asked them to share it forward and so on. And we got some participants from Prolific too, which is just a website where you can pay participants to complete surveys. And these were all people from the US and Canada. Because we were interested in the timeline of COVID, the psychological timeline, we kind of broke this timeline down based on big COVID-related events that happened. So in the US, it was the first warning signals came in the last week of February. Like I said, that's why we were at SPSP. We didn't know at that point. On the 29th of February was when the first US death occurred. And shortly, so anything before that, anything before February 25th, we call baseline. And starting from February 25th, we treat as the warning period up until March 11th, when things got pretty serious and it became clear that we were in the middle of a crisis. On March 11th, COVID was declared a global pandemic, and shortly afterwards, a national emergency in the US. And immediately afterwards, there were shelter-in-place rules. We all started staying home, working from home. So this we call the isolation phase. And there's some past work on other kinds of crises showing that typically when there's an unexpected, shocking event, that collective event that occurs, like a hurricane or an earthquake, it takes typically about 6 weeks for most people to psychologically recover. But this is not a theoretical or kind of definite time point. It's just a descriptive time point that we use to be able to interpret our results. So we thought that even though COVID is a prolonged crisis, that there would still be this kind of initial shock of something unexpected happening. And we thought maybe at around that 6-week point, it would stabilize to some kind of a new COVID normal that is past that initial peak that we would expect to see. So we call this the normalization phase. Okay, so with that, I'll jump right into my first research question, looking at the timeline of various psychological variables. Okay, so I'm going to show you a bunch of different variables. So it might feel like I'm just listing descriptive effects, and I'll try to tie it all together in a couple of slides. So just bear with me for a bit. I'll orient you to this graph. So in this graph, we looked at tracked various emotions, expression of emotions on Reddit in people's everyday conversations over time. So the x-axis is just chronology, and you can see these bars here behind. That's just to kind of help us know. Sorry, there's some kind of an error here. This should have just been normalization. We renamed it from adaptation to normalization. So I've kind of messed up my slides. So what we did was we tracked all of these variables over time, and just the y-axis here, it's a normalized score. We kind of de-meaned or centered all the scores around 0. So it's not very interpretable. It's not meaningful. The only meaningful kind of comparison is to be able to track any emotion. For instance, this brown line is anxiety, and track that over time to see how much of an increase there has been. And if you're interested in effect sizes, I have effect sizes reported on the right. So what you see with the anxiety effect, which is one of the biggest effects in our data set, is that around that time when the first warning signal starts, so this is the last week of February when the first death occurs, there is a peak in anxiety, in expressions of anxiety in these contexts, a huge increase, which then reaches its peak around the time when COVID is declared to be a pandemic. So our anxiety increases, and then we are told this is an emergency and it's a crisis. And then after that, things kind of recover expressions of emotion, of anxiety, they reduce, but what you see is that they don't really go back to baseline in this entire time period. And this is just 3 months, but one of my colleagues has analyzed data until the end of 2020, and anxiety levels don't go back to baseline until the end of 2020. So first is this huge increase in anxiety, which primarily goes up initially, even before we knew it's a crisis, when there's the first warning signals that we don't know to make sense of yet. But it reaches its peak in the beginning of this isolation period. And if you look at the yellow line here, that's the expressions of positive emotion. It's almost a mirror image, just slightly weaker effects. You see that immediately after we know there's something going on, there's a drop in positive emotion expressions, reaches its bottommost point around when COVID is declared an emergency. And from then it recovers, but it doesn't really go back to baseline. And if you're wondering where the confidence intervals of these graphs are, there actually are confidence intervals. You just can't see them. They're very tiny because there's a lot of data. Another effect that I think is very interesting is sadness. And if you look at it, it's a slightly different timeline. Expressions of sadness don't go up on day one when we know something is coming. It's a more delayed kind of offset increase, and it seems to especially go up around the time when we start staying home. So this could be possibly just because we are now at home, we don't get to see, we don't get to live our community life or see our friends or people at work any longer. So that's one possibility. Another one is it could be the effects of seeing loss of life, because that typically is like there's a 10-day period between seeing increase in cases and deaths. So it may be a reaction to that. We aren't really able to disentangle those causal effects, but that might be what is going on there. And the red line is anger. You see, this was unexpected. We thought there might be an increase in anger, especially that is targeted at the government for not for their initial response to the pandemic, but we actually see a drop in anger. This peak that you see here, that was around the time when they were the first anti-mask or anti-social distancing protests that happened. I think it was in Minnesota or Minneapolis, I'm not super sure, but those were the first big protests that happened. That's why you see this increase in anger. But one interesting thing, even though we didn't expect this drop in anger, was that it replicates. There's a different paper looking at emotional expression across countries in Europe, and they see pretty much the same effect. One possibility is that in these initial periods of anxiety, when we knew there's a threat coming, it's maybe we prioritize anxiety in like a flight or fight kind of way, because it's perhaps adaptive in some sense as opposed to anger, but that's just me speculating, I'm not sure. So these were emotional effects. We also looked at two different kinds of cognitive variables that typically get expressed in people's language. One is called analytic thinking. This is not actually a dictionary. This is captured using a previously determined algorithm using other data. And this is the kind of language we use when we are thinking in a logical, analytical kind of way, where we have our thoughts organized, the kind of thinking, the kind of writing you'd see in New York Times, for instance, or in a formal journal paper, as opposed to more narrative conversational thinking, where we're just telling a story, not expressing our organized thoughts in any kind of clear way. And what we see here is this huge drop in analytic thinking. This is also pretty, for this, the effect, as you can see, is 0.16. And for social media context, that is pretty huge. You see that around that same time as the initial warning signals emerge, there's a big drop in analytic thinking, which then gets to its bottommost point during the isolation phase, and then recovers, but then not all that much. And this is also an effect that replicates. One of my colleagues analyzed emails from an organization as part of some work she was doing, and they find pretty much the same thing. The interesting thing was they found this effect, the drop in analytic, especially for people lower in the hierarchy, like employees lower in the hierarchy of the university. So it may, of the organization. So it may be that this is experienced primarily by people for whom COVID effects were more personal or more real, but again, speculation, it's not clear why. But the way we are thinking about this is that it could be that when there's an increase in threat, there's an increase in anxiety, which takes up a lot of cognitive resources, and we just don't have the cognitive bandwidth to be able to think in a logical, clear, structured kind of way. And we are still making sense of everything that is going on, and we don't have a clear picture yet. So what then comes out is this more narrative storytelling kind of way of talking as we're still making sense of what is going on. Another kind of cognitive variable that is often looked at in language is called cognitive processing. This one is a little easier to interpret. These are words like think, maybe, unsure, why, the kind of words people use when they're trying to work through something. And you see these words go up whenever people have any kind of issue to process. You see this go up when people are dealing with a phase of depression, or after a romantic breakup, or after it went up after 9/11. So pretty much after any kind of unexpected event that we have to, or not necessarily even unexpected, like difficult events that we want to make sense of that is still unresolved. You see these words going up, and this is kind of a slow increase, unlike unlike anxiety, for instance, that goes up at this point, which may be that we're slowly, as this event starts to hit us, we're starting to make sense of it. And it's just what we're seeing on Reddit is some expressions of this collective sense making that people are doing. The last kind of variable I'll talk about is people's how connected they feel to others around them. This is actually survey data. And in the survey, we asked people how much more or less connected they felt to various groups. And what we saw, so we had 2 survey samples, like I said, and this effect looks exactly the same across them, which makes it, I didn't really believe this effect, but then that it replicated across 2 samples, across 2 very different samples, was promising. So what we're seeing here is that people, this midpoint means people felt only as connected as, there was no change because of COVID, they felt as connected as in baseline. But what you see is that for most people said they felt more connected to their family because of COVID, but not so much to any kind of non-family group like friends, their city, or their country. And the family effect is probably one possibility, is because we were staying at home. A lot of people spent more time with their family. But another one that I think may be more likely is that we all feel responsible for our family, even if they're far away. So initially, when a crisis hits, family is the first people we're worried about. So when you feel responsible, you also feel closer to them and you care more about them, you're thinking about them. So that may be what we are seeing here. One thing I should say is, though, these are only perceived change. So we didn't actually have any baseline data. So it's not like we asked people how they were connected, how connected they were before and after, and subtracted the scores. We asked people about their the difference they perceived. So this is self-reported in a way. It could be that for some reason people just feel like they're closer to family, but they were not objectively closer, but we can't confirm that with this data set. The cool thing, though, is that it's almost never the case that it's possible to compare social media data and survey data and see that they produce similar effects. And this was one such instance, which is why I wanted to show you both these graphs, like just juxtapose them, these graphs. And what you see on what we did on the right was, this is Reddit data. Our logic here was that when we talk about a group, it typically means that that group is on our mind. We talk about the people who we're paying attention to, who we're thinking about. And the colors here match the colors here. So the order, if you see, there's orange, blue, yellow, green, it's kind of the same as this. And what we're seeing here is that people's references to family, they use family words more after the onset of the pandemic. And this, again, like these don't seem to be, the big jumps don't seem to be around the time when there were warnings. They seem to be, a bit slow, a bit delayed in their increases or drops. What we see is that people are talking more about their family than they did at baseline. But then with more kind of distant groups, like even friends, there is a drop in talking about friends. And this is an effect that goes on for almost 3 months. It's only at some points here and there that it almost touches the 0 point. And what this seems is like kind of an out of sight, out of mind type effect, where we don't get to see our friends, which just means we don't think about them all that much. And there's also a huge drop in talking about the city, which may be because people are just not getting to experience their city in the same way. They don't have all that much to say about their city because they are forced to stay at home. And this effect is probably big just because this is a city community where the reason people come here is to talk about this, but they just don't get that same city experience. One effect that is very messy is the blue one. It's talking about the US. And one reason why it's messy is that a lot of the references to US are about the news, about COVID numbers and so on. So it's not very clear how to interpret those effects. But what is clear from across these graphs, it seems that people felt closer to family, but not so much to groups beyond, so their social community beyond family. So just to summarize, I showed you a lot of effects. Just to kind of bring them all together and summarize, it seems the main effects we found were a big increase in anxiety and a decrease in analytic thinking, which started when the first warning signs showed up, even before we knew COVID was a pandemic or a crisis. Those things were triggered first, but then slowly over time, there was also an increase in sadness and a weakening of relations to non-family groups, which seem to be especially associated with staying at home. The second question we looked at we wanted to see if these effects, the psychological effects that I just showed you, how linked are they to the spread of the virus? So is it just like these timelines that I showed you are just what happens after any kind of prolonged event hits? Is that just exactly what, is that almost inevitable, independent of how the COVID spreads or where it spreads? Or is the effect tied to how fast the COVID spread, where it spread, and so on? And the way we did this was that I was able to get COVID case numbers from the New York Times COVID database. And I did this at two levels. So one was at the city level. So for instance, if we have data from Chicago, for instance, and we got COVID case numbers for every day of the data set. So January 10th to May 23rd. And similarly for all the cities. And we also did this at the US level to be able to kind of disentangle the effect of COVID spread in one city versus COVID spread in one country. And the other thing we did was for every city, we got this analysis was not at the individual level, it was at the city level. So for every city, we computed averages of the psychological dimensions that I just talked about. So we had these COVID for each day and each city, we had a city level COVID growth rate. Sorry, I should have said this. We got case numbers from the COVID database, but we computed growth rates, which is essentially how much on any day the COVID case number increased from the day before. And we did this in a number of ways, looking at linear increase, but also exponential increase, and the results are pretty similar across those. So we had COVID case growth rate for each day at the city level, at the national level, and also all the psychological variables the average psychological variables for every city for each date. And our question essentially was, if COVID spread faster today, let's say in Chicago, do we see stronger psychological effects tomorrow? And similarly, if COVID spread faster at the national level, do we see an amplification of effects the next day? This graph shows all the effects we have. These are what we're plotting here is coefficients from a mixed effects model. So it's like coefficients from a regression. This approach was better suited for our data. And I will orient you to this graph. So this x-axis here, these are coefficients from the regression. From the mixed effects model. And so each dimension here, that was a different model. So for instance, this is a model predicting anxiety, and we had two predictors. One was the city growth rate, which is the orange line or the reddish line. The other one was the bluish one, is the national COVID growth rate. So what this, just to interpret this first model for a second, what this tells us is that the effect of city level growth rate and national level growth rate on anxiety was positive, meaning that if today COVID spread faster in Chicago, there would be greater anxiety tomorrow in Chicago. But also if at the national level COVID spread faster in the US, tomorrow we'd see a greater increase in anxiety. So if you kind of skim through this graph, we could go through each of these, but I don't have the time for that today. So I'm just going to kind of zoom out. What you see is that across these, a lot of the effects were amplified by the pandemic. And generally, they're pretty much always actually in the same direction as the effects I showed you. So for instance, greater anxiety, drop in analytic thinking, so anything to the left of the zero line means it's a negative effect. So drop in analytic thinking. For cognitive processing, somewhat positive effect, family positive, all of these other ones negative. The US, this one's the only messy one that again is somewhat positive. So one thing that you'd see from across these is that a lot of these effects, one, are amplified by greater spread of the virus. And second, it's not always consistent. And what you see is that typically it's the blue line that overlaps with zero. The red ones show stronger effects, which means that these psychological effects were primarily linked to greater COVID growth rate at the city level as opposed to at the national level. So at the national level, we see some effects still. For instance, there is still increased anxiety when COVID spreads faster at the country level, a small drop in analytic thinking, an increase in family. But across the board, the effects are stronger for the city level. Okay, so this analysis, what it tells us is that we can track the link between these social media expressed psychological effects to the spread of the virus. And these links appear to be stronger for the city level than for the country level, which I was a bit surprised by. I thought most people would watch national level news, and so their emotions and their feelings would track national level COVID cases better. But this is very interesting because it tells us that people's psychological effects may have been really tied to their actual levels of threat in their city. Finally, this is the last analysis I'm going to show today. This was an exploratory question where we thought, because we have all of this data, can we go back in time and track the last several years and see how big these effects really are? Is it just that it feels like COVID is making everybody depressed, or is it really different than the last several years? Are these effects substantially or observably bigger than previous years? So what we did was, for each of these cities, we got a lot of these cities go back, the communities on Reddit, they go back several years. So we were able to get all the conversations that happened in the last decade. So we then plotted everything, all the psychological variables I showed you, but starting from 2011 all the way up to now, to see how big the current effects really are compared to the last several years. This is a lot of effects. We don't need to focus on each of these, but across the board, the x-axis here is just time. So chronology, this last couple, each point in these graphs is a month, the average across all the cities for a month. So what you see, these last 3 or 4 points, those correspond to COVID, because this analysis, I think we stopped in May, so it has 3 months of COVID. And what you see is that across the board, these COVID-produced effects are way bigger than any big change we've seen in the last several years. For instance, anxiety has just in the last 10 years across these cities not gone up to the same extent as it did in the first 3 months of COVID. So it's a huge effect. If you look at these coins, these are at the city level, not at the individual level. That's why they're this high, because at the city level, these dimensions are relatively stable. They don't change. And despite how stable they generally are, we see these huge increases. Same for sadness. It's a pretty big effect. Drop in analytic thinking. There are some effects that you don't really see. For instance, the US effect, it's just kind of messy, like in the other graphs I showed you. The friend effect, almost, it looks pretty small, almost like noise. But most of the other ones are observably larger than most of the effects in the last several years. And one thing I want to highlight here for anyone who might be interested in using this type of approach for a different analysis is that you see some of these big temporal trends. Like, for instance, there's a huge drop in positive emotion starting from 2011 to 16. Which on first glance may be interpreted as, oh, people have just become less happy from 2011 to 16. It's not clear that that's the case. I don't think survey data from representative survey data tracks those drops. So this is very likely to be explained by how social media may be differently used over time. So for instance, if it is true that we have increasingly started to use social media to discuss politics, for instance, it would make sense that there's then a drop in positive emotion because we're talking more about political things that make us angry as opposed to more personal, family, everyday life type things. Increase in cognitive processing, we're trying to make sense of what's going on, drop in talking about personal things like friends, slight increase in talking about the US. This is just my speculation, or also increase in anger, that's a big one. This is my speculation for why these effects may be changing, but the broader point I'm trying to make is that there may be differences in how we use social media, which produces a lot of these big over time effects, which may not really mean that psychologically we're changing all that much. The useful thing just for this type of analysis is especially useful for tracking something like COVID, because we wouldn't really assume that in this 5-month period, the meaning of social media and society has changed all that much. It's more likely that it's produced by this event or COVID. Okay, so to quickly summarize from tracking the timeline from conversations that people had across 18 US cities, what we see is that generally there's an increase in anxiety, drop in analytic thinking, and these were first triggered by initial warnings and then amplified later as people started staying at home. There's also a slightly offset delayed pattern where there's increase in sadness and a weaker sense of community. This seems to be primarily, it starts around the time when we're staying at home, so could be primarily triggered by isolation. And all of these effects did not return to baseline for our entire time period, and some other unpublished analysis suggests that they may have gone on for several months after. And these effects seem to be linked to the spread of the virus, especially at the city level, and these effects were bigger than most effects in the past decade. I see I'm running out of time. This is my last slide. I'll quickly just go over this. This is just for anybody who's interested in using social media data. It has a lot of strengths, but definitely has weaknesses. The biggest strength is that it's possible to go back in time. And it's also possible to kind of zoom in and capture day-to-day changes in a way that is possible using other methods, but quite difficult. So for instance, if we use a method to give people the same survey every day, for instance, that is doable, but then there might be some kind of survey fatigue. But here we don't have to ask people how they feel. So we can get their true expressions as they're naturally living their life. It's also possible to do these spatial analyses because we can figure out where people are living using these communities on Reddit or GPS on other platforms. And finally, the biggest limitations are that we don't know who we're studying. We have no idea who these people are, especially on Reddit. And because we don't know that, it's hard to capture demographic differences or differences in, for instance, we can't figure out if somebody lost their job and maybe those would have worsened their effects. So if they actually got COVID, that again, you'd imagine has worse psychological effects. So we're not able to capture these individual differences. And this also means that these are somewhat biased samples because Reddit samples tend to be younger than the average population, so they're not very representative. I'll conclude with that. Thank you so much for listening. I'm happy to take any questions. I'll paste the paper's link on the chat, but you can also use this QR code.